results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212-CHOICES, 212-CHOICES for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. Not only super convenient, super. Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212-CHOICES, 212-CHOICES.
With Dr. Lederman, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based on PSA, Gleason score, and stage. That's why Dr. Lederman's custom-tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid, accepted. Call Dr. Lederman at 212-CHOICES, 212-CHOICES for a fresh second opinion and free booklet DVD. Not only super convenient, super in Manhattan, 38th and Broadway. To hit the cancer, call Dr. Lederman, 212-CHOICES. Cherish your life. Custom prostate cancer treatment with Dr. Lederman, 212-CHOICES.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR Studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212-CHOICES for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
Hey, we're back. It's Dr. Lederman. We have several callers. We're going to try to get to all the callers. Stay on the line. We are working to get to you. And if you have questions after the show ends, call me directly at 212-CHOICES, and I will answer your questions. Peter, good evening.
Good evening. I know a woman, she's about 60. She had, about a year ago, she had a melanoma on the scalp. It was removed. But then they did a MRI of the brain, and they said they found a small tumor. They said it was benign, very small. It grows very slowly. And they told her to come back in a year. But in the meantime, she gets headaches. So I'm wondering, can benign tumor, can they tell if it's benign from the MRI, and can benign tumor cause headaches?
Well, everything can happen. In medicine, there's no 100%, there's no never, there's no always. But if she has headaches, neurologic change, the concern about melanoma is that it can get in the bloodstream and spread anywhere in the body. So if you have a history of melanoma and you have headaches, you should get an MRI with contrast to check out what's going on. An MRI has no radiation, so there's no risk to her. And maybe even check out her whole body. So the answer is, it's worrisome she had melanoma, it's worrisome she has a headache, and even benign tumors sometimes are misdiagnosed. So it may have, in fact, been a melanoma a year ago that was misdiagnosed.
A PET scan, how would they check the whole body?
Well, PET scan does not show much in the brain. PET scan is an injection of radioactive sugar, and it doesn't show much in the brain because the brain uses a lot of sugar always. So for the brain, an MRI with contrast is the best way to go. For the rest of the body, usually a PET scan is the best way to go, usually.
All right, so you do all this in your center? All
if she comes to us, yes, we can take care of everything for her in our center if she wishes.
I see. But a benign, they could check from the MRI with contrast if it's benign, or
yes, they can most likely tell you.
Okay, thank you very much.
God bless you, and thank you. Okay, we have Gary on the line. Good evening, Gary.
Yes, hi, Dr. Lederman. I have a question about prostate cancer. I understand that there's a new test out that sort of replaces or augments the PSA test, something called the 4K score test, and it differs from the PSA in as much as the PSA has only one indicator or one marker, but this so-called 4K score test has four. Is supposed to be more definitive, more...
right, so there's many new tests available for prostate cancer. Some of them are covered, most of them are not covered. The latest test actually is about $350, so you're welcome to come in and have that if you want. I would tell you that for most men, the PSA is a fantastic test. PSA is reliable. We know how to use it. It's cheap. It's available. It's accessible. So, and it's not only about the PSA. And no test by itself is perfect without, obviously, a biopsy. But give us a call. Come in and we'll talk about it. Call us 212-CHOICES. We'll tell you exactly what's going on, okay?
Thank you very much, Doctor.
Thank you. I have a caller. Hello, good evening. It's Dr. Lederman who's calling. Yeah, why don't you call after the show? We're on the radio show, so just call the same number after the show is done. Call after 10 minutes, okay? In 10 minutes, okay? Okay, Jim is on the line.
Dr. Lederman?
Yes, sir. How are you tonight?
I guess I'm emotionally upset because I had prostate cancer at Gleason 7, and 4 different doctors told me to get surgery because they said, you know, I'm 67, but they said you're in good shape, you're relatively young,
right.
You really want to get that cancer out of your body. And for me, it was worse than anybody because so I could qualify, I had to get open heart surgery for valves repair on the heart. And that happened in last May, and in last September, I had the prostate surgery in New York City. I thought he was an internationally renowned surgeon, and it's not fair to say this to you because I feel I've been lied to because they told me, I heard you say 60%, and I think you're right. I'm totally incontinent. The PSA is now 1.2.
Okay, so it's failed. How's your sex life? Is it working or not working?
The what?
Is the sex life working or not working?
0.
Okay, well, that's exactly what I've been telling men. And the problem is there's this conspiracy of silence. And if you came to us for Gleason 7, you would have had a 90% chance instead of a 60% chance. So after surgery, your PSA should be 0. So by definition, they failed you. Your cancer is back, number 1. Number 2, they damaged the nerves. So your sex life is gone and your urinary life is gone. So it's a wipeout. And that's what I'm trying to tell men in advance. If you have cancer, not to suffer like you. Our patients don't need open heart surgery to have our treatment. Our treatment is non-invasive treatment, so it's easy treatment. Now, I will tell you, okay, so you've suffered, you've lost sex life, you've lost urinary life, the cancer came back after your surgery. That's expected. That's really expected. That's normal. But there is a chance, actually, and I have data which I was going to present on this show, but I'll probably present it on tomorrow's show, that if we can see you, we may be able to give you a second chance of treatment and cure. So there is a second chance for you with our focused beam radiation. We can't take away what the surgeon did, but we may be able to clean up those cancer cells.
Yeah, because I did not sign up for that. You know, the way they spoke about it, the chance of you being around losing sexual function is close to 0, and that's a flat-out lie.
It's a lie. Look at the data. Here's a data. If you get our page 614 of our booklet, sexual problems after surgery is 97%. Okay, it's in the booklet. It's reported data. So when they slap you on the back and say, you're going to be fine, you're going to have all the erections you want, it's not true. It's not true. They say those things to convince you to have the surgery. Unfortunately, for many, it's an economic issue. It's a conspiracy against the patients. Did they show you their data versus our data?
They had no data except verbally, and it's...
verbally is like a moonbeam. Here today, gone tomorrow. Our data is written. It's in a book. It's published. As I said, we just presented our data at the national cancer meetings. We present data all the time. And we do that so people can see the difference. It's a huge difference. And I don't want other men suffering like you're suffering. Unfortunately, we didn't get to meet beforehand. But if we met beforehand, I would have shown you the data. I would have shown you exactly the results of surgery, which is 60% for Gleason 7, 90% for us with our radiosurgery frame and brachytherapy, and the majority of the men sexually intact and 99% controlling their urine.
Dr. Lederman, what happens to the tissue? That's why they scared me. They made me think that even if it got radiation at the time, they said the cancer will remain in your body. Is
That's
that what
not true
happened?
at all. That's not true. I mean, look at Rudy Giuliani. He had radiation and seeds in 2000s, 14 years ago. He's cancer-free. Most people are cancer-free after our treatment. We're just about at the end of the hour, so I apologize I can't spend more time with you, but please call me at 212-CHOICES, which is 212-246-4237, 212-246-4237. I want to speak with you and meet with you. You do have another chance. So this is Dr. Lederman. Thank you for listening. God bless you. And we'll be on again tomorrow morning, WOR, at 6 to 7 a.m., and tomorrow night at 9 to 10 p.m. Thank you. God bless you, and good night.
Thanks for tuning in to the Radiosurgery Hour with Dr. Gil Lederman and myself. If you have questions before next week's show or want a free informative booklet and DVD, just contact Dr. Lederman at 212-CHOICES. That's 212-246-4237. That's 212-246-4237. Till next week.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. That's Dr. Lederman, the radiosurgery pioneer's goal, too. Dr. Lederman is first in America, first in New York, first for you with body radiosurgery. Dr. Lederman hits your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212-CHOICES, 212-CHOICES for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. Not only super convenient, super. Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212-CHOICES, 212-CHOICES.
The proceeding was a paid program. WOR's airing of this program constitutes neither an endorsement of the products offered or the ideas expressed, 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 or the